3 towel exercises performed 10 to 15 minutes before intimacy could help you maintain firmness and prevent that frustrating moment when hardness fades mid-performance, and the science behind why this works is more solid than most men realize. A standard bath towel, when used correctly for pelvic positioning, muscle activation, and circulation enhancement, can target the exact physiological systems that control erectile quality and duration, but most men have never been taught the proper sequence or timing that makes these techniques actually effective. I'm Dr. Christine Rodriguez from Men's Vitality Hub. For over 14 years, I've helped men over 45 improve their sexual vitality using evidence-based techniques that don't require medications, expensive devices, or complicated protocols. According to research published in the International Journal of Impotence Research, strategic pelvic floor activation combined with postural optimization can significantly improve erectile rigidity and control. The key is targeting multiple systems simultaneously: muscle engagement, blood flow, and nerve pathway activation. Here's what we'll cover: why losing firmness mid-performance happens in the first place, the 3 specific towel techniques that address this problem through different physiological mechanisms, the exact timing and sequence that maximizes effectiveness, and what to avoid that eliminates the benefits entirely. Because when you understand how these exercises prepare your body for sustained performance, you'll have a complete pre-intimacy protocol that takes less than 5 minutes and uses equipment you already own. Before we dive into the techniques, let's talk honestly about why this problem happens, because understanding the mechanism is the first step toward fixing it. Losing firmness during sexual activity is one of the most common and frustrating experiences men over 45 face, and it's rarely caused by just one factor. Usually, it's a combination of 3 interconnected issues: inadequate pelvic floor strength, compromised circulation, and poor muscle coordination. First, let's talk about the pelvic floor. Your pelvic floor is a hammock-like group of muscles spanning from your pubic bone to your tailbone. These muscles have a direct role in erectile function. Specifically, they help trap blood inside the erectile chambers once an erection begins. When your pelvic floor muscles are weak or poorly coordinated, they can't maintain the compression needed to keep blood locked in place. Blood flows during arousal, but it also leaks back out because the muscular valve system isn't functioning properly. Imagine trying to inflate a tire with a slow leak. You might get some air in, but you can't maintain full pressure. That's exactly what happens when pelvic floor muscles aren't engaged correctly. Second, circulation issues. As men age, arterial flexibility decreases and blood flow to the pelvic region becomes less efficient. This means that even if you achieve initial firmness, maintaining it requires continuous blood flow under adequate pressure. If your circulation is sluggish or if you're in a position that restricts pelvic blood flow, firmness will fade naturally as the erectile tissue doesn't receive the constant supply it needs. Third, poor muscle coordination and positioning. During sexual activity, your body needs to maintain specific muscle engagement patterns. Your glutes, core, hip flexors, and pelvic floor all need to work together in coordinated rhythm. When these muscle groups aren't properly activated beforehand, or when your pelvic positioning is off, the entire kinetic chain breaks down. You might start strong, but as fatigue sets in, or as positioning shifts, the muscular support for erectile function collapses. According to studies in sexual medicine, men who perform targeted pelvic floor activation before intimacy demonstrate significantly better erectile maintenance compared to those who don't prepare their musculature. Here's the critical insight. These 3 towel exercises target all 3 of these underlying issues simultaneously. They activate your pelvic floor, enhance circulation, and train proper muscle coordination, all in less than 5 minutes. And they work because they're done before intimacy, giving your body time to respond physiologically without creating fatigue or overstimulation right at the critical moment. Still with me? Because the first technique I'm about to show you activates the foundational muscle groups that support everything else. The first technique is called the supported pelvic lift, and it targets your glutes, core, and lower back, the foundational muscle groups that stabilize your pelvis and support circulation during sexual activity. The setup. Take a standard bath towel and roll it tightly lengthwise, creating a firm cylinder about 4 to 5 inches in diameter. You want it dense enough to provide structural support. Lie on your back on a comfortable surface. Your bed or a yoga mat on the floor works perfectly. Position the rolled towel horizontally under your lower back, right at the level where a belt would sit. Your hips should rest slightly elevated compared to your shoulders. Place your feet flat on the surface, hip width apart with your knees bent at approximately 90 degrees. The movement. From this starting position, engage your glutes and lift your hips upward, creating a straight line from your knees through your hips to your shoulders. This is a bridge position, but the towel provides additional support and elevation. Hold this lifted position for 5 full seconds. Focus on squeezing your glutes firmly. You should feel tension in your buttocks and the back of your thighs. Lower your hips slowly and with control back to the starting position. Don't just drop down. The eccentric, lowering phase is just as important as the lift. Perform 8 to 10 repetitions, maintaining consistent breathing throughout. Inhale as you lower, exhale as you lift. What this technique accomplishes. Glute activation. Your gluteal muscles, particularly the gluteus maximus, play a crucial role in pelvic stability during thrusting movements. When these muscles are properly engaged, they support the pelvic floor and enhance blood flow to the entire region. According to biomechanical research, strong glute activation during sexual activity correlates with better erectile maintenance because these muscles help drive blood into the pelvic region with each movement. Core engagement. The bridge position with towel support forces your core muscles, particularly your deep abdominal stabilizers and lower back muscles, to engage. This creates a stable platform for your pelvis, preventing the positional shifts that can compromise circulation. Spinal decompression and nerve activation. The towel placement creates gentle traction in your lumbar spine, temporarily increasing the space between vertebrae. This relieves pressure on the sacral nerve roots, specifically S2, S3, and S4, which carry the erectile signals from your brain to your penis. When these nerves have more space to function, signal transmission improves, and your body responds more effectively to arousal cues. Long-term benefits. Performed regularly as part of your pre-intimacy routine, this exercise strengthens the entire posterior chain, glutes, hamstrings, and lower back. Over weeks and months, this translates to better baseline pelvic stability and improved erectile function even without the pre-activation protocol. Common mistakes to avoid. Don't arch your lower back excessively during the lift. The goal is a straight line from knees to shoulders, not hyperextension. Don't hold your breath. Consistent breathing maintains oxygen delivery to working muscles. Don't rush through the repetitions. Quality and control matter more than speed. The first technique lays the foundation. Now let's move to the second, which directly targets the muscles that control erectile firmness. The second technique is called the adductor compression, and it directly activates your inner thigh muscles and pelvic floor, the specific muscle groups that control blood retention during erections. The setup. Remain lying on your back with the rolled towel still positioned under your lower back. Your hips should be slightly elevated, feet flat on the surface, knees bent. Take the rolled towel and reposition it between your knees. It should be firmly wedged so that when you squeeze your knees together, you compress the towel significantly. The movement. Squeeze your knees together forcefully, compressing the towel between them. As you squeeze, consciously engage your inner thigh muscles. You should feel tension running from your knees up into your groin. Hold this compression for 3 full seconds at maximum tension. Don't just squeeze lightly. Really compress that towel as if you're trying to flatten it completely. Release slowly over 2 seconds, allowing your knees to return to their starting position with control. Don't let them spring apart. Perform 10 repetitions, maintaining rhythmic breathing. Exhale during the squeeze. Inhale during the release. What this technique accomplishes. Adductor muscle activation. Your adductor muscles, the inner thigh muscles, have a direct neurological and mechanical connection to your pelvic floor. When you forcefully engage your adductors, you create what's called irradiation, a phenomenon where muscle activation in one area automatically triggers activation in connected muscle groups. In this case, squeezing your inner thighs fires your pelvic floor muscles reflexively. According to research in pelvic floor physiotherapy, adductor exercises are among the most effective indirect methods for strengthening pelvic floor function, particularly in men who have difficulty isolating these muscles through traditional Kegel exercises. Pelvic floor engagement. The pelvic floor muscles, particularly the bulbospongiosus and ischiocavernosus muscles, are directly responsible for maintaining erectile firmness. These muscles compress the base of the penis and the erectile chambers, trapping blood inside and preventing venous outflow. When you perform the adductor compression exercise, you're training these muscles to activate on demand. This is the exact mechanism you need during sexual activity to maintain firmness. The ability to engage and sustain pelvic floor contraction without conscious effort. Blood flow enhancement. The rhythmic squeezing and releasing creates a pumping effect in the blood vessels of your inner thighs and pelvic region. Blood is compressed out during the squeeze, then rushes back in during the release. This alternating compression and relaxation improves local circulation and primes the vascular system for increased demand. Neuromuscular patterning. By repeating this exercise before intimacy, you're creating a neuromuscular memory. Your body learns to activate these muscles automatically when needed, rather than requiring conscious thought during sexual activity. Over time, this patterning becomes automatic. Your pelvic floor engages reflexively during arousal and maintains that engagement throughout performance. Common mistakes to avoid. Don't squeeze weakly. Maximum compression is what creates the training effect. Don't hold your breath. Breathing maintains oxygen delivery and prevents unnecessary tension. Don't rush the release. The controlled relaxation phase is just as important as the contraction. Are you starting to see how each technique builds on the previous one? The third and final exercise optimizes everything we've activated so far. The third and final technique is called the pelvic mobility flow, and it optimizes blood flow patterns while training your body to maintain proper positioning during sexual activity. The setup. Return to your original position, lying on your back with the rolled towel under your lower back, feet flat on the surface, knees bent. Place your hands gently on your hip bones for proprioceptive feedback. This helps you feel the movement more clearly. The movement. Gently rock your pelvis forward, tilting it toward an anterior pelvic tilt. Your lower back will press slightly more into the towel, and your pubic bone will lift slightly upward. Hold this forward position for 3 seconds. Then rock your pelvis backward into a posterior pelvic tilt. Your lower back will lift slightly off the towel, and your tailbone will tuck under. Hold this backward position for 3 seconds. Perform 8 repetitions in each direction, 8 forward tilts, 8 backward tilts, moving smoothly and with control between positions. What this technique accomplishes: circulation optimization. The rocking motion creates a wave-like pumping effect through all the blood vessels in your pelvis. As you tilt forward, blood pulls in the anterior pelvic region. As you tilt backward, it redistributes posteriorly. This alternating flow pattern is similar to the natural circulatory rhythm during sexual activity. By training this pattern beforehand, you're essentially warming up your vascular system for the increased demand it's about to face. According to vascular physiology research, rhythmic movement patterns increase arterial elasticity and improve blood vessel responsiveness, both critical for maintaining erections during extended sexual activity. Positional training. One of the most overlooked causes of lost firmness during sex is poor pelvic positioning. When your pelvis tilts too far backward, you compress blood vessels and reduce flow. When it tilts too far forward, you can hyperextend your lower back and create muscular fatigue. The pelvic mobility flow trains your body to find and maintain the optimal neutral position, the sweet spot where circulation is maximized, nerve pathways are open, and muscular support is balanced. Nerve pathway activation. The gentle rocking motion dynamically decompresses and decompresses your sacral nerve roots. This movement pattern stimulates these nerves, ensuring they're firing optimally and ready to transmit erectile signals efficiently. Think of it like flexing a cable before using it. You're ensuring there are no kinks or resistance points that could interfere with signal transmission. Mind-body connection. This final exercise also serves a psychological purpose. The slow, controlled movement forces you to be present in your body and aware of your pelvic region. This mindful awareness translates into better control and confidence during sexual activity. Common mistakes to avoid. Don't rock too quickly. The controlled pace is what creates the circulatory benefit. Don't exaggerate the movement. Small, controlled tilts are more effective than extreme ranges of motion. Don't lose focus. Pay attention to how each position feels. This awareness is part of the training. Still watching? That tells me you're serious about improving your performance, and that commitment is exactly what creates lasting results. Now let's talk about the critical factors that make these techniques work: proper timing, correct sequencing, and realistic expectations about results. The optimal timing. Perform all 3 exercises 10 to 15 minutes before sexual activity, not immediately before. This timing window is crucial. Why this window matters: when you perform these exercises, you're creating physiological changes, increased blood flow, activated muscle patterns, stimulated nerve pathways. But these changes take time to fully develop. If you do the exercises immediately before sex, you might create muscular fatigue rather than activation. Your muscles need a brief recovery period to transition from the training stimulus to functional performance. The 10 to 15 minute window allows your circulation to increase, your muscles to remain engaged but not fatigued, and your nervous system to integrate the activation patterns without overstimulation. The correct sequence. Always perform the exercises in the order I've presented them. First, the supported pelvic lift, 8 to 10 repetitions. This activates the foundational muscles, glutes, core, lower back. Second, the adductor compression, 10 repetitions. This directly engages your pelvic floor through the inner thigh connection. Third, the pelvic mobility flow, 8 repetitions each direction. This optimizes circulation and positioning. This sequence is strategic. You start with the large foundational muscle groups, then progress to the specific performance muscles, and finish with the circulation and positioning optimization. Each exercise builds on the previous one, creating a cumulative effect that's more powerful than performing them in random order. What to expect? Realistic timeline. First use. Many men notice improved firmness and better control during their very first attempt. The immediate activation of dormant muscle groups and enhanced circulation often produces noticeable results right away. First week. With consistent use before each sexual encounter, most men report significant improvements in confidence, control, and ability to maintain firmness throughout performance. 2 to 4 weeks. As the neuromuscular patterns become more established, the benefits become even more pronounced. You'll likely notice that you need less conscious effort to maintain firmness. It starts happening automatically because your body has learned the pattern. Long-term benefits. Beyond the immediate pre-intimacy benefits, regular practice of these exercises strengthens your baseline pelvic floor function, improves overall circulation, and enhances core stability. Over months, this translates to better erectile function even without the pre-activation protocol. Important considerations. These exercises don't replace medical treatment for serious erectile dysfunction caused by vascular disease, neurological conditions, or severe hormonal imbalances. But for most men experiencing age-related decline or performance anxiety, they address the most common underlying issues effectively. Let me address the most common mistakes I see men make with these techniques because these errors completely eliminate the benefits. Mistake number 1: skipping the sequence. Some men think, I'll just do the one that seems most important. That doesn't work. All 3 exercises are necessary. The first activates the foundation, the second engages the performance muscles, and the third optimizes circulation and positioning. Skipping any step breaks the chain and reduces effectiveness dramatically. You need all 3 working together to create the synergistic effect. Mistake number 2: rushing through the movements. These aren't high-intensity exercises. They're activation and preparation exercises. The controlled timing, holding for specific durations, lowering slowly, breathing rhythmically is what creates the neuromuscular training effect. If you rush through them, you're just going through motions without creating actual physiological change. Slow and controlled beats, fast and sloppy every time. Mistake number 3: performing them immediately before sex. This is a timing error I see frequently. Men think, more is better, so I'll do these right before. But remember, your muscles need that 10 to 15-minute window to transition from activated to functional. Doing the exercises immediately before creates fatigue, not readiness. Set a timer if you need to. Do the exercises, then use that 10-15-minute window for foreplay, connection, or simply relaxing together. By the time you engage sexually, your body will be primed perfectly. Mistake number 4: inconsistent practice. Doing these exercises once and expecting permanent results doesn't work. This is a practice, not a one-time fix. Neuromuscular patterns require repetition to become established. Circulation improvements require consistent stimulation to become baseline enhancements. Use these exercises before every sexual encounter for at least 2 to 4 weeks. Once the patterns are established and you're seeing consistent results, you can experiment with reducing frequency if desired. Mistake number 5: using incorrect towel thickness. If your towel is too thin when rolled, it won't provide adequate support or resistance. If it's too thick, it might create discomfort or improper positioning. A standard bath towel rolled tightly is ideal for most men. Experiment slightly to find what works for your body, but stay within that general guideline. Let me give you the complete protocol in one clear summary so you have everything you need to implement this tonight. Equipment needed: 1 standard bath towel. Total time required: 4 to 5 minutes for the exercises, plus 10 to 15 minutes before intimacy. The complete 3 exercise sequence. Exercise 1: supported pelvic lift. Roll towel lengthwise, place under lower back, feet flat. Knees bent. Lift hips into bridge position. Hold 5 seconds. Lower with control. 8. 10 repetitions. Exercise. 2. Adductor compression. Towel between knees. Lying on back, squeeze knees together forcefully for 3 seconds. Release slowly over 2 seconds. 10 repetitions. Exercise 3. Pelvic mobility flow. Towel under lower back, hands on hips. Rock pelvis forward for 3 seconds. Rock pelvis backward for 3 seconds. 8 repetitions in each direction. Timing. Perform all 3 exercises 10 to 15 minutes before sexual activity. Frequency. Before each sexual encounter, or at minimum 3 to 4 times per week to establish baseline improvements. Expected results. Immediate, better firmness and control during first use. Week 1. Noticeable improvements in confidence and performance. Weeks 2 to 4. Establish patterns, more automatic responses. Long-term, enhance baseline erectile function and pelvic strength. Safety notes. If you experience pain during any exercise, reduce range of motion or resistance. If you have chronic lower back problems, herniated discs, or recent pelvic surgery, consult your physician before starting this protocol. This is the complete system. Simple, equipment minimal, and physiologically targeted to address the exact mechanisms that control erectile maintenance. If this video gave you a complete, actionable protocol using nothing but a standard towel, I'd really appreciate it if you'd hit that like button. It helps other men find these evidence-based techniques when they're searching for real solutions to improve their performance and confidence. And if you're new here, welcome to Men's Vitality Hub, where we focus on prostate health, hormonal balance, and practical strategies that help men over 45 maintain strength, vitality, and sexual function naturally. Subscribe and turn on notifications so you never miss content that can genuinely improve your quality of life. Before we finish, I want to hear from you. Drop a comment below and tell me, where are you watching from? I love seeing the global community we're building here. And answer this. Are you going to try these 3 towel exercises before your next intimate encounter? Let me know in the comments. And if you'd like, share which aspect of performance you're most focused on improving: firmness, duration, or confidence. Remember, you don't need expensive equipment or complicated protocols. You need the right techniques applied consistently. This is Dr. Christine Rodriguez from Men's Vitality Hub reminding you, your body isn't broken. It's not past its prime. It just needs proper activation and preparation. Do the exercises, trust the sequence, honor the timing, and watch your confidence and performance respond. I'll see you in the next one.